A pleasant day, everyone. This is Geraldine Ilustrabita from Catalunan Pequeña National High School, a teacher in a school clinic in charge. Recognizing the impacts of the COVID-19 pandemic to a person's mental health, the Department of Education, through its Disaster Risk Reduction and Management Service, in coordination with various DepEd Central Office units and partners, launched a series of mental health and psychosocial support services provisions for DepEd personnel. Today, we will have a walkthrough to the psychosocial support services, which covers mental health, basic psychosocial skills, remote psychological first aid, and self-care practices in managing stress. So come on, free yourself and enjoy as we learn together. Mental health and psychosocial support, MHPSS, is used to describe any type of local support that aims to protect or promote psychosocial well-being and or prevent or treat mental disorder. Mental health and psychosocial support has its core principle. We have human rights and equity, participation, do no harm, building on available resources and capacities, integrated support system, and multi-layered supports. Under the core value of multi-layered support is the MHPSS intervention pyramid, wherein, like Maslow's hierarchy of needs, the bottom should be provided before it reaches the top. At the bottom is the social consideration in basic services and security. The well-being of all people should be protected through the provision of basic needs in a way that is participatory, safe, and socially appropriate. The next level in the hierarchy to maintain their mental and psychosocial well-being is strengthening the community and family supports. And the next step is focus on non-specialized supports in which psychosocial first aid is being provided. At the top is the specialized services in which psychological or psychiatric intervention is needed. In this level, seeking of medical professionals is needed. MHPSS involves many activities. It includes assessment, collecting of data, peer support activities, following up activities, supervision and case management, and of course, basic training in psychological first aid or PFA. So let's move forward in the discussion of psychological first aid or PFA. Let us define PFA. PFA is a method of helping people in distress so they feel calm and supported to cope better with their challenges. PFA also helps normalize worry and emotions, and it also promotes healthy coping and provides feeling of safety. The primary goal of PFA is to capacitate the person short and long-term adaptive skills and coping to surpass COVID crisis. One of the hindrance condition of current pandemic is the physical distance, and this physical distance can be bridged to different modes of communication. It may include phone or internet calls, applications, or other social media. Keeping a physical distance to others is required during outbreak. But physical distance can be bridged by keeping socially connected with others. That is why there is a remote psychological first aid or RPFA. So let's take a look on the action principles of PFA. The first one is you have to look. The second one is you have to listen. And the third one is you have to link. In the principle of look, you will be assessing needs and planning considerations. Number 1, what is their current situation? Number 2, what are the practical and emotional support they might need? Number 3, what the risks are. Number 4, the needs of the affected. And number 5, the expected emotional reactions. So how can we identify or assess if one of our colleagues is on distress? So we have to look for the following signs. Number 1, the post on social media. It could be on Facebook, Instagram, or Twitter. Number 2, they exclude themselves from others. Number 3,
They no longer respond to correspondences like your calls or any messages. Number 4, also have low work productivity, poor work output, does not submit on time, does not attend any meetings. So poor socialization. How to approach or help our colleague in distress. Number 1, we have to monitor their reactions. We have to ask, but we should not assume. Approach respectfully and let us not push ourselves. Let us empathize. Reassure as best as you can. Like reactions are normal responses to an abnormal situation. We should understand. We should offer support, help in accessing reliable resources or self-care, and we should refer them if necessary. Let's proceed to the next principle, which is listen. So, how to begin conversation? Asking about needs and concerns. How do we respond to calls? Let us take a look on how we are going to respond to a call. Number 1, we have to introduce ourselves. Number 2, ask how you can be of help. Number 3, agree on the duration of the call. Number 4, listen to the practical and emotional needs of the client. Number 5, you ask about coping, self-care, and stress management. Number 6, ask what the caller will choose to do and assist the caller to find out the things they can do, or suggest they write a list of inspiration. You also give them information or connect them to social support. If referral is necessary, you refer the caller and you end the conversation. So there are words or phrases that would help us convey interest and empathy. So here are the key psychosocial phrases. For example, number 1, I understand your concerns, and most people do think a lot about the situation. Another example is, I hear what you are saying about having to, or I fully understand that you are feeling this way. This principle of PFA is link. It refers to how the helper assists in accessing information and connecting with loved ones and social support. And it also tackles practical problems and accessing services and other help. When are we going to refer a client? So there are some criteria that we have to consider, like if the client or the patient has not been sleeping for the last week and is confused and disoriented, the client is so distressed that even taking good care of himself or herself, he could no longer do it. He or she loses control over his or her behavior. So we have also lists on the do's and don'ts in offering PFA. So here it is in the table below. Supervisors and team leaders also play a very important role in the organization. So what they can do in the organization, they have to regularly and support and monitor their staff. They also have to ensure good quality communication, encourage and facilitate access, provisions, and strategies, and also ensure that the staff gets well rest and recuperation he or she needs. Because of this outbreak, there are some issues, there are some social stigma that we should be careful with our language. Like don't refer people with the disease as COVID-19 cases or victims, or do not talk about COVID-19 suspects or suspected cases. And don't talk about the people transmitting COVID-19, and don't attach locations or ethnicity of the deceased. And also don't repeat or share unconfirmed rumors. Don't emphasize. So this is the common problem in our society. Because of rumors, we tend to misinterpret or relay information that is not needed. We have also some issues like the inclusions of the marginalized and vulnerable people in risk communication, community engagement, and psychosocial support initiatives. So those who are prone to shock, dependence of the informal economy, inadequate access to the social services, limitation, and that's all. That's it for PFA or RPFA. Let's proceed to basic psychosocial skills, a guide for COVID-19 responder. Are you a responder? Have you tried to ask yourself? Or are you performing a critical function during the COVID-19 pandemic? So if your answer is yes, this entire information is for you. So you may work as a health profession like doctor, nurse, counselor, social worker, case manager, a first responder like law enforcement officer, ambulance driver or firefighter, in food supply or preparation, in pharmacy, transportation, government, utilities or sanitation, in supporting loved ones or friends, vulnerable people in your community, or as a supervisor or manager supporting staff or volunteers. First step as a responder is you also have to look after yourself. You cannot offer help if you yourself also needs help. You should set realistic goals. You should eat healthy. You meditate. You learn how to communicate, and you learn how to screen the information that you are hearing. We can also support others with active listening. So listening is most essential part of supportive communication. Active listening, giving person your undivided attention. You listen attentively. You truly hear their concerns and you repeat it, and with care and showing respect and empathy. So you summarize at the end what you have understood. Supporting people who are experiencing stress. So what are the signs of stress? So what is stress? So stress is a natural reaction and on which everyone experiences. So we have signs of stress like emotional reactions, feeling sad, you feel angry, you feel scared, and also our behavior reactions, the lack of motivation, avoiding doing activities, and also becoming violent. And another sign is the physical reactions. You have headaches, muscle pain, back pain, difficulty sleeping, and lack of appetite. We are experiencing stress, so there are some suggestions that make us feel better, like listing the things that we are grateful. As what the saying says, you count your blessings and name them one by one. You find time to do activity you enjoy, like planting and exercise, you walk or dance, or do something that is creative. You read books, you listen to music, or you speak to your family or loved ones. An individual experience a longer or lasting term of stress, maybe he or she is experiencing serious distress. Going to do when you encounter someone in distress? You always bear in mind that safety is a priority. So your safety is a priority. And then let them know who you are. You keep the client calm, you listen, you offer practical comfort and information, you help people regain control, provide clear information. As much as possible, you also stay with the person. And if necessary, you refer to specialized support group. And now, let's proceed to self-care for educators and caregivers during pandemic. So there are 12 tips to help you take care of yourself in the coming weeks and months. So number 1 is you pay attention to how you're feeling. So you remember, it's okay not to be okay. Whatever you are experiencing, whether anxiety, sadness, worry, or fear, it's okay to recognize your feelings or your emotions. Another tip in taking good care of yourself is you limit your news intake. Remember, your thoughts produces feelings and that those thoughts can be shaped by an overexposure to negative media stories. So be intentional about the information you consume. Be kind and forgiving, embrace do-overs. Remember, be gentle and kind with yourself. Forgive yourself when things aren't going the way you'd hope or planned. You also need to be generous with others and yourself. Consciously choose to see the best in yourself and others. And remember to breathe. Through it all, remember to breathe. Simply through it may sound, breathing deeply from your stomach is not something that comes naturally to many of us. And again, having a spirit of gratitude. So you focus on gratitude. Practicing gratitude on a regular basis has been associated that lowers level anxiety, stress, and depression. First thing in the morning or at any point in the day, think of something you are grateful for. Another tip of looking after yourself is to keep a journal. So some people prefer to keep a gratitude journal or use journaling in general to help them slow down, and also maintaining a regular contemplative practice. A few minutes of mindful breathing or practices such as yoga or tai chi several times a week can make a noticeable difference. You also need to move and exercise daily if you are able. Staying active helps us to stay fit not only physically but mentally. It can help lift our mood, improve our cholesterol, lower our blood pressure, improve the quality of our sleep at night, and manage our stress. So another tip for us to take good care of ourselves is we seek out nature, fresh air, and sunlight. So studies indicate that it's good for us to spend time in nature. Being in nature lowers stress, combats depression, and promotes positivity. We should also nourish our body and soul. Remember, as always, drink lots of water. Think about what does bring a smile on your face. You eat healthy food and you meditate each day. And lastly, communication. So distance, yes, but only physically. Connection is a core human need, so reach out to friends, family, and neighbors through text or social media. Those are the tips on how to take good care or to look after ourselves. There are also few advices to those who are isolated or quarantined person. So number one, you stay socially close even when maintaining a physical distance. You plan and uphold a daily routine, set goals and keep active. Plan time alone and time together if living with others. Look for or inject humor into the situation if appropriate. Maintain hope and use stress management techniques and also accept feelings. And lastly, always remember our negative responses to COVID-19 are but normal reactions to an abnormal situations. Thank you for listening and have a wonderful day.